Hey, it's Tom at Total Motion Training Systems. Pointing out a fixed idea and a paradigm that we've come to accept is probably the ultimate thing that you want to try to set up. And that is probably that the idea of one-on-one therapy is the optimal. I know when I started treatment and when I started my practice, my slogan was one therapist, one patient, one-on-one. That's the way we differed. Okay? And I've seen a lot of practices do that, and they ended up, unless they're out in the Midwest getting $120 an hour, they ended up having to change because the reimbursement went from $120 down to $75, down to $45. Right? And then there's someone's left saying, okay, how can we have high quality, right, but needing to see more, and not only needing it, but eventually finding out that we like seeing more, because we find out the interaction between the patients is pretty fascinating. Because most of you who are seeing more, you really just have 4 people in your room together, all right, not interacting too much perhaps. That's what I see when I go out in seminars mainly. But when you start putting these people together to, not learn this exact same speed and pace, but you start putting them in a class together and they're all experiencing pain and beginning to learn from how the other one just got better and the other one just got better and how this one's changing, how this one's not changing perhaps. There's another level of learning that occurs. So what level does it take? Is it a one-to-one? One therapist, let's make that be the PT to the patient. Is it 1 to 2? Is that best? Is it 1 to 3? Is it 1 to 4? Is it 1 to 15? What ratio can we have in there that we go, this is fun. This is really neat. Well, we've tested it all the way from 1 to 12, right? And we found that if you have an energy-sucking patient, you know the ones I'm talking about, and it's you one-on-one, it is hard to get anything done and to change those people. If it's 1-on-2 and that other patient is a dynamo, you're going to help drag that other one along a little bit more. But we'll tell you, if it's 1-on-3 or 1-on-4, all right, those other 3 patients, if they're good, are really going to help make that other person kind of not be such energy suckers. They're going to have to say, wow, these people are getting better. Why am I not getting better? You begin to use peer pressure as a positive. You begin to use in groups as a positive because we're all social creatures. Right? And if you learn to set this up properly, you're going to learn that this, once you become familiar over here with this, if you did like us, that we would much rather be over here than over here. Because we have found that when in the concept of a TMR, which is to give your skill away, to leave the student engaged, to leave the patient engaged, and leave with a skill, we find that they leave with a skill more satisfied, okay? Just something nicer about it, all right? Just more effective. They like doing it with people, all right? And the TMR training system allows this to happen. And from a standpoint of a therapist, all right, you're thinking, whoa, I got to deal with all those people. The reason is because you're thinking it with your familiar territory. When you guys are thinking about, oh my gosh, I have to see this patient and that patient. You're running all over the place trying to coordinate everything and nothing's getting done. Nothing's the same, all right? Because you're using different systems within each patient. You don't have a system that you're using with multiple patients. Let me say that again. You're using many systems within many patients. That's why it's so scattered. We use a system for multiple patients. That's why it's simple and easy. So again, if I've intrigued your interest a little bit more, remember, I've got 200 TMR training systems available for clinics around the country. Once they're done, they're done. That's how many I'm teaching and treating for my career, all right? Because I want to help you become more successful.